How common is miscarriage?
Miscarriage is actually very common, and miscarriage as defined as early pregnancy loss prior to 12 or 14 weeks. And there are various definitions of it, but let's talk about first trimester miscarriage. So that is extremely common. It's estimated that up to 50%, and 50, not 15.
Wow.
50% of pregnancies end in miscarriage.
So chances are pretty high that every woman will experience at least one during their childbearing years.
Oh, absolutely.
If a woman has experienced a miscarriage, is she at higher risk for another one?
You know, that all depends on the gestational age at which she had the miscarriage, whether or not fetal cardiac motion was detected prior to the miscarriage, how many miscarriages she's had in the past, whether the miscarriages occurred in succession with each other or whether they were divided by a normal term delivery of a baby. There's so many things that go into that. In general, yes, kind of, but again, there's so much individual variation.
Well, and if you consider if the chance of miscarriage is as high as 50%,
yeah,
that you look around you and you see plenty of women who have had miscarriages and have gone on to have healthy deliveries. And so at what point is the number of miscarriages concerning?
So we generally say 3 or more. So by society criteria, 3 or more miscarriages that happen in a row is considered recurrent pregnancy loss. But we tend to start talking about interventions and workups and things after 2. Again, it depends on the gestational age at which it happened and what the circumstances are, because we don't understand the causes of miscarriage very well at all. But the causes tend to be different at earlier gestational ages compared to later gestational ages. There are some things that are easily treatable. For instance, having abnormal thyroid function can lead to miscarriage. Having an abnormal uterus shape can lead to miscarriage. These are things that we can work up and actually address. But in general, the answers to those kinds of questions are highly individualized, and this is where patients just need to speak to their doctors about it.
It sounds like it's a good idea to talk with your doctor before you get pregnant to find out if there's anything that needs to be managed so that you're as healthy as possible going into another pregnancy.
That is always true, whether you've ever had a miscarriage or not. But, and I would say, after one miscarriage, because it's so common, that's sad and it's heartbreaking. And, it's kind of impossible not to start counting grandchildren when you see a positive pregnancy test. Mm-hmm. This is just what we do as women. But it's not, it's not the kind of thing that really affects the future that much. So after one miscarriage, I don't think it's a huge deal to have to go in and see your doctor. After a couple that have occurred in a row, that's when it's time to start talking. And for certain, if it's been 3 or more, that's really the time to talk with a specialist, somebody like a reproductive endocrinologist.
If I were to go into a reproductive endocrinologist, what kinds of things might they consider or look at in order to get some direction on what might be causing it and if there's anything that can be done?
So as I mentioned a minute ago, we don't understand the causes of miscarriage very well, but there are sort of general categories of them. There can be structural problems. For instance, a uterus can have a shape that isn't amenable to carrying a baby, that often can be treated surgically to improve it. There can be hormonal problems, anything from thyroid misfunctions to estrogen, progesterone dysfunction, things like that. There can be other kinds of causes like maternal medical illness. Some autoimmune diseases are more likely to increase the risk that a woman has recurrent miscarriages. And so all of these things are extremely individualized. A typical workup so let's say that a woman has had 3 miscarriages and they have occurred in a row, right? So a typical workup would include evaluating her uterine cavity, doing some, depending on her specific situation, doing some blood work, for instance, as I mentioned, checking her thyroid. Another thing that doctors will often check, again, depending on the specifics of the situation, but they might check for antibodies called antiphospholipid antibodies. These are some relatively rare antibodies that seem to affect implantation and growth of that placenta, and they can cause both recurrent pregnancy loss and other things in past the first trimester, stillbirth, growth restriction, things like that. That's a very common condition. This is called antiphospholipid antibody syndrome, specifically obstetrical antiphospholipid antibody syndrome, if a woman's had recurrent miscarriages and has some of these antibodies. And the reason that that's important to investigate is because it's treatable. We can use, the treatment namely is heparin and aspirin through the pregnancy, and that markedly improves outcomes. So these are some of the things that a doctor would typically recommend for a patient with recurrent miscarriage. But again, it depends on so many different things, whether she's had successful pregnancies, how old she is. I mean, many, many things. Body mass index.
How does genetics play into it? Does that play a part with
recurrent
miscarriage?
One of the most common causes of miscarriage is a genetic abnormality in the fetus. And these are, again, very common. In fact, most early losses are probably due to genetic abnormalities, and it's just kind of nature's way of optimizing outcomes. And most of these are random. I mean, when you think about all of the cell divisions and DNA manipulations and all of that have to happen to make anybody normal.
Starts as 2 little cells and grows into a person. That requires a lot.
It's mind-boggling what it requires. So it's amazing anyone ends up like normal.
Yes.
Whatever that is.
Right.
But yeah, so a common cause of early miscarriage is genetic abnormality. And that's why, one miscarriage or miscarriages that are interspersed with normal, healthy pregnancies are very common, and we don't worry too much about them, even though they feel sad. Mm-hmm. But someone that has recurrent miscarriages, it certainly is worth testing the tissue for genetic abnormality.
To see if this is something that, like, my gene pool and my husband's gene pool mixed together most of the time is going to produce.
Exactly. Or at least we can get an idea about how often we would expect it to produce something. So, because some most things actually are just completely random. Mm-hmm. But there are some conditions that you would expect to occur in 1 out of 4 of a particular couple's offspring. Other conditions, you'd expect them in 1 out of 2. And those things can be addressed. They can't be fixed, but you can do things like in vitro fertilization with testing the embryo before implantation and all this. So those are rare causes, and those kinds of things tend to be something that you would see a specialist, a reproductive endocrinologist for, and a genetic counselor, because they can go through everything and determine the risk for that and decide if it's worth it to do genetic testing on the mother, on the father, on both.
And you touched on this a little bit before, but the potential causes that are attached to a potential treatment are the ones we want to focus on, because there are other causes that we can do nothing about.
Exactly.
Right? So we want to try to, hopefully going down the list, we can eliminate certain causes and focus in on something we can do to improve the outcome.
Yes, although very many times we don't find a cause, at least in half of cases of recurrent pregnancy loss. And I'm talking about, not just the 1 or the 2 and the interspersed ones. more than half of the time, we actually never find a cause. And even in those pregnancies, it's not impossible to have a healthy pregnancy. I can't tell you how many times couples have just given up and then all of a sudden they have a healthy pregnancy. We have a patient right now who had more than 10 miscarriages.
Oh my goodness.
And now this couple is having a just fine baby very, very soon. And
I'm so happy for them.
Miscarriages are sad and they're heartbreaking, and oftentimes couples feel like they can't keep trying because it's too hard and it's too emotional after they've had a certain amount of loss. But the chance of having a successful, healthy pregnancy is never, unless a person doesn't have a uterus.
So I know you're not a therapist, but you may as well have minored in it because you talk to women so frequently who experience recurrent loss. What is your advice to them on how to cope?
Yeah, so you're exactly right. We always joke in obstetrics that we're half obstetrician, half therapist, because so many of the issues that come up around pregnancy and childbearing are so deep and intrinsic to us. And, my advice, how I counsel my patients is that everybody has different ways, right? Some people have this idea that until they know that a pregnancy is really going well and they're past the first trimester, which is the highest risk for miscarriage and all of that, they don't want to tell people. Sometimes I think that that's not a great idea because
I agree with you on this. And I have to say, sorry to interrupt, but it just reminded me, I had a miscarriage for my first pregnancy. And I appreciated the fact that I told people working on labor and delivery, everyone finds out.
Oh, yeah.
And I appreciated the fact that people knew because then when I miscarried, I had someone to talk to and someone to support me through it. And I didn't feel alone. And I've told so many women that when they said I wanted to withhold it, and I said it may be hard to talk about it again and again when people that you don't know very well find out. So just don't tell them, but tell your close people because then you can have heart to hearts with them.
Yeah.
And not feel so alone.
Well, and it's something that is so common that, find me a woman who hasn't had a miscarriage.
Right.
There aren't
about
that many of them.
And they'll say, I had one too.
Yep.
Yeah.
And then people kind of get it. And, whether that translates into telling people, right away or not telling people, those are all individual decisions, but there's this kind of strange rule out there that you shouldn't tell people, or patients will say, when can I tell people that I'm pregnant? And the answer is whenever you're ready, figure out what kind of support you need. And another myth is that if it was a very early pregnancy, that it doesn't matter as much as a pregnancy that had a stillbirth later, or, somebody that had their baby and died in the neonatal period or something like that. And I think
it's a loss.
It's a loss.
You're grieving a loss. Like you said, you're counting your grandchildren the second you see that positive result.
Yep, you can't help it because it's biology. It's how we're programmed. And so I think that we just need to be very gentle and loving with ourselves around all things that have to do with pregnancy and not discount our feelings about things that happen early.
Yeah, you need to allow yourself to go through that grieving process. There's actual steps that you can expect yourself to go through. Yep. Even if it was at 5 or 6 weeks, you still are going to experience that.
Yep. And everybody goes through it differently. And because we obstetricians are most of the time not actual therapists, I think another great recommendation is to find one. There are therapists who specialize in perinatal loss and grief. People that are really, really good at knowing what the issues are, at knowing some of the things about how, often women will beat themselves up about things like miscarriage or pregnancy problems that in truth they have zero control over. But there's something about us that makes us want to suppress those things and blame ourselves, and all of that stuff it just creates unnecessary suffering. There's a group in Provo called the Healing Group, and there are many, many other people in Utah. People's doctors tend to know, people's obstetricians tend, and midwives and family medicine doctors. And I mean, basically anyone who does obstetrical care pretty much in their back pocket has an idea of who are the good people in their community who are interested in perinatal loss and grief. So I always recommend that.
So in addition to talking with your OB provider about the physical aspects of the pregnancy, feel free to open up emotionally and to talk about your feelings, because that's an important part of the process too.
Oh, that's so much. Pregnancy more than anything else, we really have to take care of the whole person because there's a lot going on and it's changing very fast and there's hormones all over the place. And so that's exactly right. Obstetrical providers are in the business of taking care of the whole person. And I always advise, talk to your provider. Let them know what's going on.
That's great advice, because then they can give you tailored information based on their knowledge of your circumstances. If you guys have more questions in the future for me, feel free to ask them on our Intermountain Moms Facebook and Instagram pages, and recommend us to your friends and family too.